Dr. Joel Baumgartner here. As far as my personal journey goes to get me where I am today, man, it goes back a few years. I remember when I was deciding about going to medical school or not, I had a summer job working as a nurse's aide. I was an art major at the time and wanted to pursue art, but I got this job as a nursing aide and I was assigned this gal named Barb. And Barb really changed my life, I think, for the good long term. She had a stroke. She couldn't do much, but by the end of the summer, I just kind of showed her some love. I spent some time with her, feeding and stuff. And by the end of that summer, Barb was feeding herself again. We would kind of slow dance before her bedtime, and I'd kind of whisper, "Barb, I love you." And she said, "I love you back." And that moment, I changed my course. I'm like, I need to help people. I need to be helping kind of do something with my skill set, which was, I think, just caring about people. So kind of fast forward, I thought if I'm going to do this, if it's fate, I should get accepted to med school. And 4 years later, got into medical school and then had to make the decision after 4 years of medical school, what should I go into? So I picked primary care. I thought I can help the most people in primary care. But I found out shortly after my, getting into my residency program that I was just writing a lot of prescriptions, doing a lot of things that weren't fixing the root cause of these problems. So then went back and applied for a sports medicine fellowship. And again, my life was changed for the good. In that fellowship, we're doing things like prolotherapy, autologous blood injections, and it really opened my eyes to this regenerative realm where we can actually heal the body, not just cover it up. So my toolbox was small at the time, but over the past 20 years, my toolbox has exploded. I've got so many things I can do to help these patients dealing with chronic pain, whether that's chronic spine pain, joint arthritis, from minimally bad to advanced arthritis. We've got tools now from interosseous to all different things that have really been showing with research now catching up to change these lives of the patients for the good. So after all that, I thought, man, if I'm doing this, I've got all these tools, this needs to be the standard of healthcare amongst the nation. So we started something called the RPI, the Regenerative Procedures Institute. What that does, it gives these 20 years of learning and skill set development into a very practical online program where you can learn everything from how to do palpation guided nerve blocks to hydrosection nerve blocks and dissecting out those fascial planes where everything's getting stuck, to every regenerative procedure in the book, from the spine to orthopedics to all the joints. And it's very comprehensive. And the nice thing about the RPI is that it's constantly expanding. We're bringing in a lot of partners into the RPI that are going to be bringing their own expertise in there to update cutting edge skill sets with fluoroscopy guidance, to different ACL procedures we can be doing, to all the right examinations people need to be doing to get the right diagnosis to then make the right change. So my vision now has changed from just not treating our patients, but expanding this opportunity for physicians around the world to really treat their patients the best they possibly can.